Welcome to HX2RX. My name is Umaba Savarajay. I am the CEO of this new EHR company. Our software is an add-on feature for your current EHR system. Once it is interfaced, you can use our anatomical image template in your current patient folder. Your patient will have access to enter history through patient portal. They will start the process of creating virtual body medical record by answering questions about chief complaints, past medical history, family history, personal history, as well as review of symptoms, guided by virtual physician assistant, either in English or Spanish. Most of the data entry is done by the patient from their home. When they come for the appointment, and anatomical images will be available for you to review in the patient folder. Following slides briefly explain how it works and how it will benefit the providers. We are eager to do virtual demo to demonstrate how simple and easy for the patient as well as doctor.
When I see the patient during the office visit, what do I see in that patient chart? Initial or established patient, you will see 5 to 8 anatomical images, which is marked by the patient. You can review the HX with a glance at each picture. It is easy to review, easy to edit. As the saying, a picture is worth 1,000 words. You can review pictures a lot faster than text documents. Next slide will show some pictures. See what you think. This is a sample comprehensive history including past history, family history and personal history entered into this visual halo. Red sector is a positive history, green sector is negative history. It is so easy to glance at this and review the history generated by the patient. Next slide will show how the doctor will annotate on this image. Doctor annotates on the same visual halo. The halo will have location for vital signs and even uploading graphs from monitoring devices. Red sector indicate that patient has diabetes. Doctor can annotate data points of either the condition is stable or worse. It is easy to annotate recommendations for screening tests like A1C as well as home monitoring. This also includes smoking and alcohol history and treatment recommendations. This takes only 2 to 3 minutes to complete, gives credits for meaningful usage. This picture reads chief complaint of discharge in the left ear, and hearing loss on the same ear. Note the marking of AB in the left ear canal as well as near the cochlea. Rest of the ear, nose and throat questions are negative. If you want to check further on the normal or abnormal symptom, you can click on it and the details will open up. It is so simple and even educative for the patient. Next slide will show the doctor annotations on the same image. Doctor annotates examination findings on the same image. It is fast and easy to do this, and the resulting picture is easy to review. It does not take much time to learn. Very minimal typing involved. Each symptom or chief complaint will have one image. This is the examination finding over the chief complaint of right-sided numbness, as marked by the red area highlighted in the left post-central gyrus. Example: black star is moderate abnormality. Blue star is normal. Red burst is worsened from before. Green tick mark is stable condition. It is easy to learn, and I might say is actually fun to create. Moreover, it recalls what doctors have learned during medical school. Image platform will also enhance his understanding when reviewed with radiological images. This is the examination finding over the review of circulatory, integumentary and respiratory systems marked by the patient. It is so easy to create and read this picture. Increased pulse is blue wave. B is brute. Marked over left carotid. Red heart icon indicated abnormal heart sound. Black star over right lung indicated decreased breath sounds. Once all the system review in the history and examination markings over those images are done, all these images will be available on mobile device. As per the meaningful usage requirement, doctors are expected to answer messages within 4 hours. Reading this images makes it easier to answer calls or text messages. This saves valuable time even for EMTs, when responding to medical emergencies. This also enhances patient engagement. How will HX2 RX saves 15 minutes for new patient and 5 minutes for established patient? Physicians and nurse practitioners spend about 15 minutes for entering past history, family history and personal history for new patient. One option is to hire a physician assistant to do that entry. Our virtual physician assistant will guide patients to enter comprehensive history into their medical record. The same record is accessed by the doctor at the time of visit. What if patients aren't technologically savvy? 80% of people has access to internet, and 46% of patients use the internet to research their symptoms and medications. HX2RX is simple and easy to use, including audio instructions at every step. Patients need encouragement to do pre-visit entry before coming to their appointment. The benefits include faster patient turnaround and more patient engagement, instead of needing to enter data into a computer during the appointment. Our survey of patients' experience indicates they want to be empowered. Some of my patients are Spanish-speaking. Right now, if a translator is not available, we have to reschedule. Even with translator, it takes a lot of time to get detailed history. Spanish-speaking patients can easily enter their answers with minimal assistance or no assistance at home. The comprehensive history will be ready for the doctor to review. During examination, it is not essential to speak the same language. After the examination, findings are annotated. The summary page will be available for patient or their surrogate to review. The summary includes recommendations from the physician to patient. We have physician assistants who do this. They help me, and I like having them. Even if your assistants are well trained, they have limited time to spend on each patient. Even with HX2RX, they will continue to check vital signs, medications, and lab results. Our questionnaire is very comprehensive. Pre-visit data entry also counts for the meaningful use measures. HX2RX Virtual Assistant can reduce the overhead of the practice. Value of HX2RX to physicians. 1. Crucial time-saving tool, 15 minutes for new patient and 5 minutes for follow-up evaluation. 2. The data is more accurate and comprehensive, because the patient inputs most of the data soon after experiencing the symptom. 3. Improve patient satisfaction while educating the patient and improving patient compliance. 4. The visit summary can be shared with EMTs and other care providers in an easy-to-follow medical record. Also improves disease management. 5. Spanish-speaking patients can enter data even if a translator is not readily available. 6. Higher levels of coding will lead to more revenue. 7. Currently offering a free trial period of 60 days, if you sign up within 30 days.